in outside of Korea, and it really the comprehensive answer given to them it takes hour and 2 hours. And I was repeatedly doing that, and then I sort of developed kind of a summary that I can present as like a probably within 2 minutes conceptual framework. Like I say, the Professor John's the 4 T's and 1 N's solution. So this is something that if you understand very clearly, then we probably would condense this webinar 2 minutes. If I say this 4 T's and 1 S and this is the answer to you, then we just go home, right? But certainly, let me just present how this 4 T's and 1 S work. The first T is conducting rapid and massive testings and the laboratory works. The second T is performing the fast digitalized contact tracing and isolation. And third T is quickly delivering well-organized, well-equipped medical treatment with quality of care. And the fourth T is total transparency in sharing digitalized information with Korean citizens, which attribute to built public trust and public confidence. And the last one, 1S. 1S is social distancing. Korean public citizens really rigorously following the practicing social distancing with the washing hands frequently and the making sure that wear masks while they are in public places, and also abandoning any social the gatherings. So these are something that has been worked out in terms of how we flattened the curve, as well as the working in hospitals and setting up the operation and procedures, all that. I expect my colleagues here will present in terms of how, elaborate how all procedures are being done at the hospital level or at the emergency laboratory testing level. All these integrated things will be presented to you. So now, this is my the happiest point to introduce the ambassadors of the Latin American countries who are being here with us. So first, I would like to invite the ambassador from the Republic of Colombia. He is the co-convener with the chairman of school. Ambassador.
Good afternoon, good night. And I want to thank you very much to the Yonsei University and all the people involved in this webinar, the World Bank. And let's hope we have to take a good opportunity of this webinar and a good result for everybody. Thank you very much.
Thank you. Invite Ambassador from Chile.
Thank you, Professor. Well, first of all, thank you to World Bank, Yonsei University. And for my country, learning about Korean experience on how to handle COVID-19 is an invaluable experience. So we value this invitation, and we hope that we have a very fruitful seminar. I want to stress the importance of this issue because, as my colleague said, this is a big crisis for us, and we're here to learn. Thank you.
Thank you. Now, Ambassador from Costa Rica.
Hello, everybody. Also, from Costa Rica, we want to say thank you to Yonsei University and World Bank for organizing this seminar. This experience from Korea is very important in this moment for our countries. Thank you.
Thank you. Ambassador from Mexico.
Good morning, muy buenos días. My name is Bruno Figueroa, and it is a great honor as Ambassador of Mexico to be part of this webinar. I also deeply thank the conveners, the World Bank, and the Yonsei University. I am certain that Mexican professionals, as professionals from so many other countries, will learn from an exchange and especially from the experience of Korea. I have witnessed firsthand in Seoul how Korea became the second country in the world by number of infections and how Korea managed to control the epidemic. So, que les sea de mucho provecho este webinar. Thank you.
Thank you, Ambassador. Now, the ambassador from Peru.
Thank you very much, and good morning, everybody. I will thank the University of Yonsei and also the World Bank for doing this meeting. I think this meeting is very important in these moments because we can realize that when we are all together, the solutions came more easy. Peru is in the side of the war. Thank you very much. Bye.
Thank you, Ambassador. Ambassadors are representing their own countries, and they are so much in the passion in serving people in the Latin America.